Bulminaka, Fiji. As always, I will start by providing you with the latest updates on our COVID-19 situation, and then get to how this has informed our various decisions in terms of response. Now, over the past 24-hour period, we have 568 new cases of COVID-19 to report. Of these, 262 cases were from the Western Division, and 306 cases are from the Central Division. Now, I want to start by saying that this significant drop in daily reported cases is not celebratory news. This should not be misinterpreted as a true reduction of COVID-19 cases in these two divisions. Over the last few weeks, we've had to shift and re-strategize our COVID-19 testing strategy to address the significant pressure on our laboratories and our health services. This includes being more targeted with our testing so that we can provide rapid turnaround results for those most at risk of severe COVID-19. We can anticipate that these shifts have an impact on our daily reported case numbers. And this is why it is critical that we use various data to inform our understanding of the current situation in these divisions. Currently, our surveillance teams are rapidly analyzing various data sources to help us build a clearer picture of the current transmission in these two divisions. However, we do know that the risk of exposure to the virus in both the Central and the Western divisions remains extremely high, with significant community transmission of the virus. On a more positive note, since our last update, there have been 664 new recoveries, which means that there are now 24,299 active cases. This adds to a total of 38,344 cases detected during the outbreak that started in April 2021. We also have an additional 13 COVID-19 deaths to report, bringing our total up to 340 since March of 2020. 3 of these people whose deaths were caused by COVID-19 had received the second dose of COVID-19 vaccine before they died. However, we know from the timeline of when their symptoms developed that 2 of these individuals were infected with the virus before they got their second dose of the vaccine. In fact, it's very likely that they got it while they were sick. We must understand that there is a difference between cure and prevention. The vaccine is not a cure for COVID-19, which means it will not help if you get vaccinated when you're already infected or sick with the virus. The vaccine helps to prevent you from getting COVID-19 and dying from it. 2 doses of the vaccine help to lower your risk of getting infected with the virus and greatly reduces your risk of severe disease and death. The third patient got sick with COVID-19 and died within 2 weeks of the second dose. So, as we have made it clear on numerous past statements, you must have 2 doses of the vaccine and wait at least 2 weeks after the second dose is administered to be considered fully vaccinated. This is because your immune system needs at least 2 weeks to react to the vaccine and form a protective response. So to be considered fully vaccinated, you need to receive both the doses, wait for 2 weeks after the second dose before you can say, okay, now I'm fully protected and the full protection of the vaccine is in effect. No one in Fiji has died from COVID-19 after they've been fully vaccinated against COVID-19. And after this, Dr. Alicia will walk us through the timeline associated with some of these deaths. As regards to the Delta variant, the situation we are fighting here in Fiji is reflective of the situation many countries are currently responding to. Globally, the Delta variant has resulted in a global surge in COVID-19 cases and is now the dominant strain of the virus. From between June to July 2021, The WHO has reported that COVID-19 infections increased globally by 80%. Over the past few weeks, we've also seen a spike in dangerous misinformation and in individuals posing as experts, providing incorrect facts about the COVID-19. We are concerned that people who are inclined to resist the vaccine will cling to that misinformation or even misconstrue facts that are reported correctly, threatening the efforts of our teams in trying to provide the best protection possible for our communities. So I want to start by explaining the facts about the current situation and this Delta variant. The WHO has described the Delta variant as the most transmissible variant to date, with the virus capable of more easily infecting a person as well as causing that person to become more infectious. It is more transmissible than the common cold or influenza. It is more transmissible than smallpox, MERS, SARS, or Ebola. It's just as, if not more transmissible than chickenpox. It may be one of the most infectious respiratory viruses humanity has ever encountered. This increased infectiousness is also reflected in what we see in countries who have seen rapid and frightening surges in COVID-19 cases, like in the UK, USA, and India. Here in Fiji, the science and the evidence also shows us that we are on the right track with responding to this new strain. The latest global data tells us that the vaccine does reduce the risk of symptomatic disease from the virus. And while some people may still be infected with the virus when fully vaccinated, COVID-19 vaccines are highly effective in reducing a person's risk of becoming seriously ill, needing hospitalization, or dying from COVID-19. After one dose of AstraZeneca's vaccine, a person is provided 71% protection from being severely ill or hospitalized. And this goes up to 92% protection after their second dose. So while we know that some people may still be infected if they were to become fully vaccinated, these vaccines provide life-saving protection from severe COVID-19 and death. A fully vaccinated person may still get infected with the virus. However, they will likely experience only mild or no symptoms because of the protection provided by these vaccines. For instance, in the UK, where they have had a high vaccination coverage rate, they are now seeing surges of cases due to the Delta variant. However, their daily hospitalizations and deaths have been less than previous COVID-19 outbreaks. For the US, we can see a similar picture where they are reporting significant spikes of COVID-19 cases and deaths in areas with high unvaccinated communities. The hospitals and intensive care units are full of the unvaccinated. These experiences from other countries and also the latest guidance from global experts provide us a picture of what we can anticipate in the future in Fiji. If we reach our goal of at least 80% vaccination of our target population, while we may see individuals infected with the virus, we will not see nearly as many people becoming seriously ill, needing hospitalization, or dying from COVID-19. Our ultimate goal remains for us to protect our friends, our family, and colleagues from becoming seriously ill or dying from this virus. And the vaccines are the best way to do that. Recent global studies have also shown that these vaccines reduce the risk of the virus spreading to other household members. In short, these vaccines will protect those who take them, but also to some extent, those that the vaccinated person comes in contact with. So we should all be vaccinated, not only for our health, but for the health of those around us, our families, friends, co-workers, and customers. The clear message that is reverberating from renowned health institutions such as the US CDC and others, and the experience of many other nations around the world that are facing the same challenge as we are, is that widespread immunity through vaccine is the only sustainable way out of this epidemic. Now, given the increased transmissibility of the new variants of concern, however, we know that vaccination alone is not the answer. We must continue to apply all the other public health measures in our toolbox that we know are effective also against these variants, like wearing masks, washing hands frequently, and maintaining physical distance from others outside of your immediate household. We are still a long way from having at least 80% of the population fully vaccinated. So these are prudent measures despite our improving vaccine coverage. For those in our community who have yet to be vaccinated, I want to again remind you, listen to the facts. Do not be misguided by the misinformation and rumors spreading within our community. The decisions you make not only affect you, but those in your family, the broader community, and the country. That being said, I want to remind everyone, vaccinated or not, you still have to be alert to your own health and immediately self-isolate if you have symptoms of COVID-19. Now, as regards to some discussion about the relaxation of our current health measures, while we are daily responding to the current situation, adjusting where necessary based on new and emerging issues, we are also planning for the future. As part of our larger mitigation strategy, there are two big factors that are driving our decision making. The first is the extent of community transmission. Second is the progress of our vaccination campaign. We established the border of the Lamino-Sori containment zone because of the high number of clusters within the specific containment area. Since this time, we have now seen increasing cases on both sides of the border, meaning that we now will be considering the benefits of keeping these measures in place. With the rise of cases in the West, as well as increasing vaccination coverage, we are now reviewing the purpose and the utility of the containment zone border entirely. Any adjustment to this containment zone will depend on the number of vaccines provided to our communities, in addition to vaccination coverage for specific locations. We know that there are communities that will see high flows of traffic once the containment zone opens up, particularly along the Coral Coast Highway, that are stopover areas for people commuting between Suva and Lautoka. Our health teams will be imminently surveying these areas to confirm what percentage of these communities have been vaccinated before we consider lifting the border. Where we do not see sufficient vaccine coverage, we are deploying our stock of Moderna COVID-19 vaccines, which has a shorter timeline for full immunization. We are also considering a revision to the curfew hours. Again, the decision hinges on vaccine coverage. The fact that we are considering these changes should not equate to complacency. This outbreak is far from over. Every technical factor shows that the risk of transmission is extremely high across Viti Levu. We do not have a specific date for you today as to when the border will be lifted or when curfew will change. But we know when those actions are taken, they will be accompanied by stringent enforcement of existing health measures, particularly our blanket restriction on social gathering. Travel from Viti Levu to the north and to the maritime islands remains highly regulated with pre-departure and quarantine protocols in place. We have no positive cases in these areas. That is a good thing and we want to keep it that way. So we have no near-term plans to change the protocol around inter-island travel. Life in these areas should continue as it is. There is no sense in putting everyone in these regions at risk. Some of the additional updates I just want to share with you today. The ministry's strategy remains to prioritizing the vaccination of the most vulnerable subgroups: people over 60, pregnant women, women with comorbidities, and other vulnerable groups. We want them vaccinated as quickly as possible. Because there's one thing we know for sure. Vaccination is safe. Vaccination is safe for people with chronic illness, and the COVID virus is extremely dangerous for people with COVID illness. I repeat, vaccination is safe for people with chronic illness, and the coronavirus is extremely dangerous for people with chronic illness. Okay? So the choice is clear. Get vaccinated or take the risk of becoming extremely ill from COVID-19. Again, we recommend anyone who falls within these vulnerable categories make arrangements to get vaccinated right away. Mobile vaccination teams will intensify their efforts to reach elderly and others who may not be able to go out for vaccination. In the Central Division, we've also strengthened our home isolation admission and discharge protocol to ensure that our data that we are using to follow up patients who are on a home isolation protocol is updated and robust. In this regard, we have unintentionally missed out on some of the individuals who should have been discharged from home isolation by now. Therefore, we want to inform all the residents of the Laminosori Containment Zone that if you have been in home isolation prior to the 27th of July 2021 and you don't have any symptoms of COVID-19, you can end your period of home isolation from today, Wednesday, 11th August 2021. If you still have symptoms of COVID-19, please present yourself to your nearest screening clinic or health facility for further assessment advice. You can also call 158 for further advice. Now, one troubling trend that we are seeing is patients arriving to hospitals dead on arrival due to COVID-19. It is upsetting. The worst thing is that it's unnecessary. We have established a hotline to detect cases of severe disease. We have teams ready to deploy and transport patients to hospital. Please keep an eye on your loved ones, particularly if they're older or have an underlying health condition. If they have serious flu-like symptoms, or if you have serious flu-like symptoms, or they have serious flu-like symptoms, please report them so that they can receive potentially life-saving care that they need. There is no cure. There is no cure for COVID. But there are measures that we can take that can save someone's life if we have the chance to take those measures. FIMET, our emergency response team, is currently conducting more medical evacuations in areas outside the current Laminosori containment zone than those from within. We had discussions with the police to ensure that the people outside the Laminosori containment zone have full and efficient access to emergency retrieval teams, should they call 165. And this access will be provided if they call it for either someone who's sick in their household, or anybody in their community, or anybody who has developed severe flu-like symptoms. So in summary, this Delta virus has changed the nature of our battle, especially in regards to vaccine breakthrough infections. But remember this, the risk of severe disease or death is reduced tenfold or greater in vaccinated individuals. So vaccine mandates will protect the vulnerable population. The risk of transmission is reduced in the vaccinated. All community mitigation strategies must be fully enforced. Wear your mask, maintain your physical distance, wash your hands often, and do not gather socially. And keep your Care Fiji app switched on at all times if you are outside your home. We need to take all these measures while we continue our vaccination program with the goal of vaccinating all adults in Fiji. We need a minimum of 80% of adults fully vaccinated, but personally I would rather get 100% coverage if possible. Then, as more data emerges worldwide about the safety of the vaccine in children, we will make a decision about recommending the vaccine for children who are at least 12 years old. So our basic message remains, everyone should arrange to get fully vaccinated, maintain the COVID safe practices we know, isolate yourself if you have mild symptoms, call 165 to receive treatment if you have severe symptoms. We all need to do our part to contain the spread of the virus. Without value.
Thank you. As announced by the Permanent Secretary, we have 568 new cases of COVID-19 to report for the 24-hour period that ended at 8 a.m. this morning. Out of those cases, 262 are from the Western Division and 306 are from the Central Division. As usual, a full breakdown of all the areas of interest will be published online tonight on the Ministry of Health's COVID-19 dashboard and on the Facebook page of the Fijian government. There have also been 664 new recoveries to report in the last 24 hours, which means there are now 24,299 active cases. 18,566 active cases are in the Central Division and 5,733 cases are in the Western Division. All the cases that were previously reported in the Northern and Eastern Divisions have recovered, and there are no active cases currently in those divisions. So in total, there have been 38,344 cases recorded since this outbreak started in April of this year. And we've recorded a total of 38,414 cases in Fiji since our first case in March last year. As announced by the Permanent Secretary, we have 13 new COVID-19 deaths to report tonight. 6 deaths were reported from the Central Division, and 7 deaths were reported from the Western Division. So the first COVID-19 death to report is a 41-year-old man from Singatoka. He presented to the Singatoka Subdivisional Hospital on the 4th of August in severe respiratory distress. His family reported that he had cough, fever, and shortness of breath for at least 6 days. He was retrieved from the Singatoka Hospital and brought to Lautoka Hospital on the same day, where he tested positive for COVID-19. He died 4 days after admission on the 8th of August. He had received the first dose of the vaccine in mid-April. He received the second dose of the vaccine on the 29th of July. However, as he had symptoms of COVID-19 before or shortly after the second dose of the vaccine, it is clear that he was infected with the virus before receiving that second dose of the vaccine. Therefore, this person was not fully vaccinated when he became infected. A person must have 2 doses of the vaccine and wait at least 2 weeks after that second dose to be considered fully vaccinated and to have the full protective effects of the vaccine. The second COVID-19 death to report is an 86-year-old woman from Tamavua. She presented to the CWM hospital in severe respiratory distress and tested positive for COVID-19 on the 5th of August. She died 3 days after admission on the 8th of August. She received a first dose of the vaccine in late May, and then she received the second dose of the vaccine on the 26th of July. However, as she got sick with COVID-19 less than 2 weeks after receiving that second dose, she was not fully vaccinated when she got infected with the virus. Again, a person must have 2 doses of the vaccine and wait at least 2 weeks after the second dose to be considered fully vaccinated and to get the full protective effect of the vaccine. The third COVID-19 death to report is a 25-year-old woman from Lautoka. She presented to the Lautoka Hospital on the 6th of August in severe respiratory distress. Her family reported that she had cough, a sore throat, and shortness of breath at least 1 week before she came to hospital. Sadly, she died 2 days after admission on the 8th of August. She received the first dose of the vaccine in early June. She received the second dose of the vaccine on the 30th of July. However, as she had symptoms of COVID-19 before or shortly after the second dose, it is clear that she was infected with the virus before she received the second dose of the vaccine. Therefore, this person was not fully vaccinated when she was infected with the virus. Again, a person must have 2 doses of the vaccine and wait at least 2 weeks after the second dose before being considered fully vaccinated and getting the full protective effect of the vaccine. The fourth COVID-19 death to report is a 39-year-old man from Lami who presented to the FEMAT Field Hospital in respiratory distress. He died on the same day of admission on the 8th of July. He was not vaccinated. The fifth COVID-19 death to report is an 88-year-old woman from Lami who died at home on the 10th of August. She received the first dose of the vaccine in late July. She had not received the second dose. This means she was not fully vaccinated. The sixth COVID-19 death to report is an 88-year-old man from Ba. He presented to the Bar Mission Hospital in severe respiratory distress. He died 1 day after admission on the 10th of August. He was not vaccinated. The 7th COVID-19 death to report is an 86-year-old woman, also from Bar. She was declared dead on arrival by the attending medical officer at the Bar Mission Hospital on the 7th of August. This means that she died at home or on her way to the hospital. She was not vaccinated. The 8th COVID-19 death to report is a 60-year-old woman, also from Bar. She was declared dead on arrival by the attending medical officer at the Bar Mission Hospital on the 8th of August. This means that she died at home or on the way to hospital. She was not vaccinated. The 9th COVID-19 death to report is an 82-year-old man from Singatoka. He was declared dead on arrival by the attending medical officer at the Singatoka Hospital on the 7th of August. This means that he died at home or on the way to hospital. He was not vaccinated. The 10th COVID-19 death to report is an 84-year-old man from Singatoka. He was declared dead on arrival by the attending medical officer at the Singatoka Hospital on the 8th of August. This means that he died at home or on the way to hospital. He was not vaccinated. The 11th COVID-19 death to report is a 56-year-old man from Nasinu who died at home on the 10th of August. He was not vaccinated. The 12th COVID-19 death to report is a 57-year-old man from Nasinu who died at home on the 10th of August. He was not vaccinated. The 13th COVID-19 death to report is a 77-year-old man from Nosori. He presented to the CWM hospital in severe respiratory distress. He died 6 days after admission. He was not vaccinated. There have been 6 more deaths of COVID-19 positive patients. However, these deaths have been classified as non-COVID deaths by their doctors. So their doctors have determined that their deaths were caused by the serious pre-existing medical conditions they had and not COVID-19. So with today's newly reported deaths, there have been 340 deaths due to COVID-19 in Fiji, with 338 of these deaths during the outbreak that started in April this year. Our national 7-day average of COVID-19 deaths per day is 7 and has remained at about 7 to 8 per day. The 7-day rolling average of COVID-19 deaths per day in Central Division is 5 deaths, and in the Western Division is 2 deaths. We also have recorded 177 COVID-19 positive patients who died from the serious medical conditions that they had before they contracted COVID-19, and these are not classified as COVID-19 deaths. So when I come up before you and talk about the deaths and detail them, it's not something that I would like to do. We announced 13 deaths from COVID-19 today. These are not just numbers. These are not just statistics, which is why I make a point to talk about them and detail how they came to hospital, how they died. This is people's loved ones. These are people who got very sick with COVID-19. Some of them came to our hospitals and were seen by our healthcare professionals who fought very hard to try and save them. Unfortunately, our healthcare professionals also have the very sad task of certifying some of these people when they came in dead on arrival. But I also want to talk, I need to talk about these deaths because there's hope as well. Because to date, nobody in Fiji has died from COVID-19 after they've been fully vaccinated. That's very important. And even if we get somebody who does die from COVID-19 in the future and is fully vaccinated, the deaths from the people who are not vaccinated will always outnumber the vaccinated. And how do we know this? Because we see this happening overseas. Right now in countries with very high vaccination rates, their ICUs, intensive care units, are filling up with people who do not get vaccinated. Because we know that this vaccine is very good at preventing severe disease and death. And here's the hope. As of the 10th of August, 523,285 Fijians have received their first dose of the vaccine. 196,873 have received their second dose. That means that 89.2% of our target population has received the first dose of the vaccine, and 33.6% of our population have received the second dose of the vaccine. Now, I know some of you are thinking that it's my choice to not get vaccinated. How does my choice affect everybody else? That's my decision. Well, it affects everybody else because the more people we have unvaccinated in the population, the worse the impact on our health system. Just like what is happening in other countries in the world, their ICUs, their hospital is filling up with people that are not vaccinated and are very, very sick. So what happens to the people who are vaccinated but get other diseases, or they get into car accidents? What happens if they need a ventilator? Because there are so many people who are unvaccinated and get very sick, they fill up our hospitals. The effect on the healthcare system is still the same. So we need everybody to please come forward, not just for yourself, but for your community, and please get vaccinated. So now I'll talk a little bit about our testing. As of yesterday, a total of 299,389 samples have been tested since the outbreak started in April. And in total, we've tested 342,250 samples since March of 2020. 1,588 tests were reported for August the 9th, and our 7-day average of testing is 2,215 tests per day, or 2.5 tests per 1,000 population. And our average 7-day daily test positivity is 34.5%. As mentioned by the Permanent Secretary, we have noted a drop in cases per day reported, but we've also had a drop in testing per day. And this is because of the change in testing policy in the Suvarnasori area. And the effect of this change in policy is now being seen with the drop in daily cases. This does not mean that the outbreak is on a downward trend in Suvarnasori. We are using other metrics, other measures to measure how much the outbreak is, where the outbreak is currently. So we're using things like hospitalizations, deaths, test positivity. So we know that our test positivity is still very high. At a national level, it's over 34%, it's 33.6%, 34%. In Suvarnasori, it's between 40 to 50%. So we still have a very high level of community transmission in this area. But the reason that we changed our testing in Suvarnasori is to target the people most at risk of severe disease, so that we can find them quickly and put them into care pathways to prevent more hospitalizations and deaths. So if you are at risk of severe COVID-19 disease, that means if you have a non-communicable disease, an NCD, or you are over the age of 50, or you have, if you're obese, or you're pregnant, and if you have any symptoms of COVID-19, so there may be very mild symptoms like a cough, a running nose, a sore throat, a fever, loss of taste or smell, we're asking you to please come to our screening clinics, please come to our health centers, get checked, get tested by our medical teams. And we need all Fijians to know the severe symptoms of COVID-19, which include difficulty breathing, chest pain, severe headache. If you have any of these symptoms, please come forward to any of our medical facilities. Thank you.
Bulawanaka, today marks the 118th day of this outbreak in Fiji. And we have, as you've heard, recorded 38,344 cases, total number of cases, and 340 deaths. Of the deaths, as you have heard, the majority, more than 83%, are not vaccinated, and 17%, or about 53 individuals, have had only one dose and are not fully vaccinated. Our isolation facilities continue to operate. We currently have 386 individuals admitted in our COVID-19 isolation facilities in the hospitals. 74 of them are in severe or critical conditions, 41% on oxygen, and 4 patients are currently ventilated. We continue to conduct screening. In our stationary screening in the last 24 hours, we saw 6,114 individuals and swabbed 776 of them, and brings our total cumulative number of screened individuals to 438,288, of which 77,238 have been swabbed. As stated by PS, we've also worked hard on our home isolation facility protocols. We currently have 19,905 individuals in the Central Division under home isolation and 3,883 individuals in the West under home isolation. We have amended our processes, and we are requesting for the Central Division, reiterating the request from PS, for those living in the Lami, Suva, and Nosori isolation zone, containment zone. If you had gone into home isolation on or before the 27th of July this year, so on the 26th, on the 25th, on the 24th, 20th, and so on, and you don't have any symptoms, you don't have sore throat, cough, fever, loss of smell and loss of taste, or headache, or shortness of breath, then consider yourself discharged from home isolation today. So from tomorrow, you can resume work and you can resume your normal engagement for your family or for your household. If you do have symptoms, please present yourself to the nearest screening clinic for further assessment, or call 158 for further clarification. Our community engagement effort, led by the NDMO office and supported by the Commissioner's office, continues in the Central and the Western Division. They've assessed more than 10,100 households in the Central Division and some 5,700 households in the West, again raising awareness on COVID-19 and addressing immediate community needs in terms of water, sanitation, and food. The data that they are getting from the assessment is assisting the ministry in directing our responses to areas of need. In regards health services, the Central and the Western Division are continuing in the mitigation phase, and the subdivisional teams in the two divisions are running the response in their respective areas. This is in terms of setting up of additional screening facilities, the intermediate care facilities, the additional isolation beds and wards in their respective facilities. The home isolation teams that follow up patients virtually or through the use of phone-based care, doing risk stratification and putting people on care pathways. They've also set up mobile teams that visit vulnerable populations, and they've set up call centers in the division to receive and process calls that come through the 165 and establish patient retrieval programs for patients. Our divisional command centers are working on improving and strengthening all these main response activity areas, and we hope to continue to see improvement as we focus on these main response actions. Our communications team are also working hard to inform members of the public on what we are doing, the changes in our strategies and processes when it happens, and also the progress of our collective response effort. Our main health facilities remain fully functional, providing emergency and essential services. Our telehealth services through 165 continues, supporting those with chronic diseases, including mental health diseases, obstetrics, and children's health. And we've also in the last week started training our staff on psychological first aid, where they are able to identify patients that they see at the front line, at the screening clinics, who need psychological and mental support. They provide some initial care and also connect them to the services that can support them further. We've started training for our Northern Division staff over 2 days, 3 days, 4th to the 6th of this month, and then we'll roll it out to the Central and the Western Division as well. In addition to all of this, our vaccination campaign remains on course to meet the targets we've set to not only vaccinate the target population, but also acquire adequate vaccine for our people. To conclude, our message remains that given the challenges we are facing right now, that we need to work together to protect the vulnerable and the elderly in our families and our community. And we can do this by a number of ways. First of all, we need to tell them that to protect them, we will not visit them. We do not need to stay with them if we do not live in the household that they live in. Because as you know, when people move between households, they carry the disease with them. Don't bring people together or congregate people in their presence or in the households where they live. Avoid sending children and young people to see them, especially if they don't live in the same household. Saying hello over the fence or through the gate without contact or by phone or social media should be the norm for now. I understand that it's hard. It's difficult for families and for the elderly and those who are vulnerable, but it's important that we protect them this way. Use mask when you are in their presence. Wash your hands with soap and water or with alcohol hand rub. Social distance. Cover your mouth, your nose when you cough or sneeze. And if they are symptomatic, please get them to be checked by our team quickly. They need to be assessed early, and we need to put a plan of management for them to ensure that when they need immediate health care, they get them. And finally, make sure they are vaccinated and make sure we are all vaccinated. And good evening.